Clearly, talking about sex is important, but in fact, it can pose a significant barrier for both the patient and the physician, because in our society we're taught not to talk about sex, at least not to talk about it in honest, sometimes scary terms.
As an infectious disease physician, in terms of thinking about the whole issue of prevention of HIV infection, certainly I have a role. I have a role on a societal level to try and make sure that we have as few new infections as possible. I have a role in terms of being a physician in a public health setting to try and integrate messages about prevention within that setting. And as an individual physician taking care of an individual patient, I have a role in terms of trying to speak with the patient about prevention in terms of their role in prevention.
I've had one provider in particular where I was in a situation where my partner, who was also HIV positive, this has been a number of years ago, but this provider was both of our physician, and she did work with both of us on that, and we had a close rapport, and we could, talk pretty specifically about sex and other things, and it felt good, it felt comfortable.
Disclosure is a very difficult thing. I've been having to do it several times this past year, and it's never easy to do. Having some help to do that and maybe some discussion with a provider as to how to do that might make it a lot easier for people to disclose. And because disclosure is extremely important, it has to happen.
I've been involved with this program as a lead trainer since it began, and it's been very rewarding to see it continue to evolve and improve based on feedback from people living with HIV and from HIV providers who are involved in this kind of work across the country. We train everyone at the clinic, providers and staff. The provider giving this message is key, but health educators, social workers, and others can help support the message as well. And it's important that they all be trained. What's nice about this program is that in addition to an interactive training, participating sites get a complete package of support materials that have everything needed to conduct this intervention at their facility. The Partnership for Health package includes waiting room and exam room posters in English and Spanish, patient brochures in English and Spanish, supplemental informational flyers on a variety of related topics, also in English and Spanish, comprehensive training manual, patient chart stickers, and pocket guides, which serve as a counseling reference for providers.
The patient can look at his or her provider and say, wow, that person does care about me and cares about the rest of my life, not just whether I'm taking my meds or not. That's huge.
Mm-hmm. I think that it's important because of all the misinformation, because it closes the gap. I may not trust everything that you say, but if my doctor says it to me, then I must trust him because he is the doctor and he should be well informed. If I cannot trust my doctor, why am I seeing him? If my doctor's not going to open to me, then why am I seeing him?